Okay, so today we are going to discuss the cerebrospinal fluid. I think it's a very easy topic. I will just go through it. The cerebrospinal fluid is a modified tissue fluid. It's contained in the ventricular system of the brain and in the subarachnoid space around the brains and spinal cord. CSF replaces lymph in the CNS. You know, in the whole body, rest of the body, we have lymph, which collects the filtered plasma or like extra fluid from the body in the third space. Wherever there is accumulation of fluid in the third space, so it is collected by lymphatic vessels and bring back into the vascular system or vascular compartment. So the same goes from brain as well, but in brain the system is a bit different, which is called cerebrospinal fluid instead of lymph, and there is a separate space for it. So the total quantity of CSF is about 150, which is kept nearly constant, and it is replaced 8 hourly. The normal pressure of the CSF is 60 to 150 millimeter of water. This pressure may be raised by straining, cuffing, or compressing the internal jugular veins in the neck. How is CSF formed? The bulk of the CSF is formed by the choroid plexuses of the lateral ventricles. Okay, so lateral ventricles, third ventricle, and fourth ventricle, all ventricle contains their own choroid plexus, but the bulk is mostly formed by the choroid plexus of the lateral ventricles and lesser amounts by the choroid plexus of the third and fourth ventricle. These are the choroid plexus. You can see this, the red one. So possibly it is also formed by the capillaries on the surface of the brain and spinal cord as well. Okay, we will come to this diagram later on, but first we go through these important things which can be placed in exam. Okay, so what is cistern in the brain? What is cistern? That is very important. What is cistern in the brain? A cistern in the brain refers to a wider area of the subarachnoid space where cerebrospinal fluid collects. These spaces form due to the separation of the arachnoid and pia mater. So when arachnoid and pia mater are separated, so they can form the cistern, and they are located in area where the brain contours create gaps. Wherever there is a gap in the parenchyma of the brain, so they form. So there is a space which is called cistern, and it is formed by the separation of the subarachnoid and pia mater. Okay, so this, you can remember this definition as like the cisterns are referred to the widened areas in the subarachnoid space where cerebrospinal fluid collects, and this is formed by the separation of the pia and arachnoid mater. So here, look at this diagram. This is very important. Look at this diagram. So we have the cerebral cortex. This is the cerebral cortex. This is the corpus callosum. Okay, here we have the hypothalamus, and this is brain stem for sure. We have this the cerebellum, yes, and here we have the pituitary, and here is the this one is the chiasma. Okay, so leaving it, we comes to the main thing that we have this superior sagittal sinus, solely this superior sagittal sinus, and then we have this yes. Okay, so the cistern is the cisterna magna is here. This is the cisterna magna. This is not a good diagram. We can move to some other diagram as well. Here, yes. So this is, you can say this is the lateral ventricles here on both sides of the brain like this. I will make the diagram here for you. Okay, so let's suppose these are the lateral and then connect through foramen of Monroe with the third ventricle. The third ventricle goes through aqueduct of Sylvius or the cerebral aqueduct, and it joins the fourth ventricle, which is here is the cerebellum. Okay, so this empties through the median foramen of Magendie and lateral foramina, which are called foramina of Luschka. Then they empty into the subarachnoid space. Okay, so this, they have their own arachnoid plexus, mainly comes from this choroid plexus, but some can be contributed by the third and fourth ventricle as well. Okay, so here we have, okay, now we will just follow this diagram. So here we have this, I will change this. Okay, so here we have this diagram. So here we can see that this is the superior sagittal sinus, this is the straight sinus. Here we have the great cerebral vein, of Galen, and here is the subarachnoid space. So from the lateral ventricles it comes to the third ventricle. Third ventricle is here, and then it comes the cerebral aqueduct, and we have the fourth ventricle, and you can see the red choroid plexus of each ventricle. So this is the third ventricle, this is the fourth ventricle, and this is the central canal of spinal cord. This is the yes. So we have here we have enlargement of the subarachnoid space, which is called cisterna magna. Okay, so basically this comes from the lateral ventricle into a third ventricle, and then the cerebral aqueduct, and then the fourth ventricle. Yes. Oh, another important that, okay, so this comes into the subarachnoid space, and this subarachnoid space circulates throughout the brain here. Throughout the brain here it circulates, but you may ask the question that how from the subarachnoid space this goes into the venous sinuses. So this, let's suppose this is the subarachnoid space and we have this venous sinus. So these are the villi, araconite granulations, araconite villi which combines to form araconite granulation. So through this they filter into the venous sinus. Okay, so here is the same diagram again. We can just go through these labelings. This is the pericallosal cistern, and here we have, since we know that this is the chiasma, with this we have the chiasmatic sinus cistern, and okay, we have the interpeduncular cistern. Interpeduncular, this is the midbrain, and the midbrain has peduncles. Midbrain has peduncle. So in between these there is a interpeduncular. We have the, here is the cisterna magna, and here we have the quadrigeminal cistern. So these are various cisterns. Okay, various cistern. This is perimedullary cistern, peripontine cistern. So on the basis of location they have named them. So we go through these questions. What is the function of cistern? Facilitate the circulation of CSF around the brain and spinal cord, serve as a reservoir for CSF, and play a role in cushioning the brain. Since we know that where there is a gap, there is a cistern, then they will cushion it. Otherwise, there will be herniation, or you can say there can be a movement of the parenchyma of the brain. What is the name of the largest cistern? Cerebellomedullary cistern. Cerebellomedullary cistern, cisterna magna. So this is the largest cistern. This is the largest cistern. Okay. Clinical importance of cistern. Cistern serves as a key areas for identifying pathologies such as hydrocephalus. Enlargement of the cistern can occur due to abnormal CSF flow or accumulation. Subarachnoid hemorrhage. Blood can collect in the cistern following trauma or aneurysm rupture, which is visible on imaging studies like CT scan. Okay, so blood can collect there. Assessment of mass effect. Displacement, or compression or obliteration of cistern on imaging can indicate increased intracranial pressure. Yes, brain herniation or space occupying lesion like a motor or abscess. For example, this is your brain. Here we have this cistern, and this is another cerebrum. So if there is a space occupying lesion, it will grow enlarge and enlarge and enlarge, so it can vanish the cistern. So here CSF leak identification. Cisternography can identify CSF leak, helping locate the site of leakage in condition like spontaneous intracranial hypertension. So these are the, like, they can cushion it, the brain. There can be collection of blood when there is a rupture of a vessel. So this is all about the CSF.